So the first test you're going to do is for the ACL. And we know that the ACL, when it's torn, or when it's not torn, the ACL actually prevents the tibia from coming anterior, right? Or from moving anterior, translating anteriorly. So we're going to try to replicate that same motion in order to determine whether the ACL is intact or not. So initially what I'll do is I'm going to find the top of the tibia, right? Which is right here with my thumbs. I can walk my thumbs up, and I can find the top of the bottom of the femur here. And then I can walk my thumbs back down, and there's this gap. So that's actually the joint space. That's actually where the meniscus sits too, right on the top portion of the tibia. Then I can walk my thumbs out, and I actually can feel the medial collateral ligament here, and I can feel the lateral collateral ligament there, right? So you can actually palpate different structures and anatomical landmarks of the knee. So what I'm going to do is I'm going to take his anterior portion of his tibia, the posterior portion of his tibia and his fibula, and I'm just going to pull and translate it as hard as I can, or not as hard as I can, but just translate it enough to where you feel movement or not, right? A good solid ACL knee, a good solid knee with an intact ACL, that tibia is not going to slide at all. Now, an ACL that's torn, you will feel some shifting of the tibia on the femur. Okay, so that's ACL, that's anterior jaw test. You'll do that one. Posterior jaw test, I slide my thumbs, I put my palms of my hand right where my thumbs were, and now I'm going to translate posteriorly tibia on the femur to see if there's shifting as well. Remember the dashboard injury? Dashboard, boom, hits the tibia, translate the tibia posteriorly, so much force that the PCL will tear, right? So we want to test that. You can also use your thumbs here to push, but I feel like it's a lot easier for me to use my palms of my hand and push in that direction. So that's the posterior jaw test. Next is valgus. This is testing, varus. This is testing the LCL. And so I'm going to remember the force of the force going into the medial side of the knee creates enough stretch and gapping on the lateral side of the knee to where it will tear the lateral collateral ligament. So we have to partially recreate that motion to determine whether there's gapping of the lateral portion of the knee and whether there's pain. So I put my hand here, my right hand here. I can sit on the table. I can actually rest his leg on my leg. That's fine. Right hand here if it's the left leg. Left hand, palm inside the medial side of the left knee. And I'm just going to shift it, right? So just a nice, easy shift. I'll do it in extension. If there's no pain in extension, I'll move to maybe about 30 degrees of flexion, maybe a little less. And then I'll try to shift again and determine whether there's pain on the lateral portion of the knee. If there's pain on the medial portion of the knee when I'm pressing, remember, the trauma comes from that side. It potentially could create bruising on that. So we're not really too concerned about the pain where my hand is. That's varus stress test. Valgus is, why don't you come on this side, and you guys will probably have to skedaddle. Valgus is opposite. Left leg, left hand, medial ankle, right hand, lateral knee. And now I'm going to create the same motion, right? Remember, outside of the knee force creates gapping on the inside of the knee and potential MCL, a stretching of the MCL and potential tear. So I'm going to create the same amount of technique, not the same amount of force, obviously, but just enough to where I determine whether I can feel it gap more and whether he has pain on the inside of his knee. So left hand inside of the ankle, right hand outside of the knee. I shift it. So I'm just shifting this way. I'm trying to push a little bit in that direction. And then no pain there,